If you have RLS and take any other medications, then watch this. 6 years into dealing with RLS, I thought I understood my triggers: diet, sleep habits, stress levels. But there was one category of triggers I wasn't looking at all. And it turns out my doctor wasn't either. It's medications. So, not just the prescriptions specifically for RLS, I mean the ones you're taking for completely separate reasons. The antidepressant for your anxiety, or the sleep aid you grabbed at the pharmacy, the antihistamine for your allergies. Some of these medications interfere with the exact same neurotransmitter that's already dysfunctional in RLS. And if your doctor prescribed them without mentioning this connection, it's not because they're a bad doctor, it's because the RLS connection is rarely taught and updates to the best treatment methods have only changed recently. So, let me walk you through what you need to know. The key neurotransmitter here is dopamine. If you have RLS, your brain has a dopamine signaling problem, specifically in the areas that control movement and sensory processing. This is why the most effective RLS medications work on the dopamine system. The problem is that several common medications reduce dopamine activity as part of how they work. And when you take them, they can trigger RLS symptoms or make existing symptoms significantly worse. The biggest category is SSRIs. These are antidepressants like Prozac, Lexapro, Zoloft, and Paxil. SSRIs work by increasing serotonin in your brain, but serotonin and dopamine have an inverse relationship. When serotonin goes up, dopamine activity tends to go down. For most people, that's a manageable trade-off. But for someone with RLS, it can be the difference between a tolerable night and a completely sleepless one. I want to be very clear here. I'm not telling you to stop taking your antidepressant. If you need it for your mental health, well, that matters. What I am saying is this: if you have RLS and you're on an SSRI and your symptoms seem particularly bad, this connection is worth a conversation with your doctor. Now, here's where it gets interesting. So not all antidepressants work the same way. There is one antidepressant that works differently when it comes to dopamine. It's called bupropion, the generic name for Wellbutrin. It's a dopamine and norepinephrine reuptake inhibitor. Instead of indirectly lowering dopamine, it actually increases dopamine availability. Several studies have suggested it doesn't worsen RLS the way SSRIs do. And for some patients, it may even improve symptoms. This is worth knowing if you're in a conversation with your doctor about treating both depression and RLS. You can ask specifically whether bupropion might be an appropriate option for your situation. The second category I want to talk about is over-the-counter sleep aids. This one catches people completely off guard. If you have RLS and you also struggle to fall asleep, you've probably reached for a sleep aid at some point. Benadryl, ZzzQuil, Unisom, Tylenol, Advil, those type of medications. All of these contain an ingredient called diphenhydramine. Diphenhydramine is an antihistamine that makes you drowsy, but it also blocks dopamine receptors. You can't sleep because your legs won't stop moving, so you take a sleep aid, and the sleep aid makes your legs worse. If a sleep aid has ever seemed to backfire on you, this is exactly why. Now, the third category is older prescription medications used for nausea and other conditions. Metoclopramide, promethazine, prochlorperazine, and some other tricyclic antidepressants can all directly block dopamine receptors. If you've started any of these and your RLS has gotten worse since, then that's a conversation again to bring to your doctor. So, what do you actually do with this information? Well, first, make a list of the medications that you're currently taking. Every over-the-counter, every supplement, every single one. Second, at your next appointment, ask this specific question: do any of these medications affect dopamine levels? And could any of them be worsening my RLS? Third, if you're on an SSRI and your RLS is severe, ask whether bupropion might be a clinically appropriate alternative for your specific situation. You're not there to tell your doctor what to do. You are there to have an informed conversation. That's a very different thing. And most doctors respond well to patients who come in with specific evidence-based questions. One more thing. If your RLS has gotten significantly worse over time and you've also started a new medication in the last 6 to 12 months, don't assume the worsening is just your RLS progressing naturally. Medication-triggered worsening is one of the most commonly missed explanations, and it is often misread as disease progression. So ask the question of your doctor. If you haven't seen my full treatment ranking video yet, I'll link that here. It covers major RLS treatments ranked by clinical evidence, and it puts everything we covered today into a broader context. Follow the channel for more RLS truths your doctor won't tell you.